Well, if you do think of anything as I'm just making a few brief comments, then feel free to let me know at the end. So it's been an interesting, perhaps not the correct word, a challenging few months, and in some ways it's gone in ways that we predicted, and in other ways it's gone in ways that we couldn't have predicted, um, or perhaps didn't predict. And I think I was correct in thinking one thing, which is that there would likely be people who would overreact to this, and there people who would underreact to it, and that sort of spectrum of over and underreaction, or perhaps even misreactions, has continued even today. But just to kind of, from my standpoint, as someone who thinks about this stuff a lot, um, the good news is that I think uh, in Minnesota we did a pretty good job at what we set out to do months ago, which was to try to flatten the curve of case numbers. And we certainly did see a substantial peak in case numbers that, was kind of where it was projected to be, even in March. So, we were having that was kind of occurred around the middle of May, sort of the week of May 18th, is if you kind of look back at the Department of Public Health's um, data right now, it sort of suggests that we hit a peak, and it's a pretty flat looking curve compared to some of the other similar sized cities and similar states in the country. We have actually, since that point, started to creep down, both in terms of the number of new cases diagnosed each day, as well as the number of deaths on a given day. So, for example, I think yesterday there were 6 reported deaths, and that contrasts to a peak in the 30s for the entire state around the middle of May. So, I think that suggests some real progress, and I don't think that we saw any real stories from Minnesota specifically, um, that were similar to the things that I was really concerned about, which was, overwhelming the capacity of healthcare. So I think that as a state, we were able to provide very high quality care to people with COVID-19, and I am proud that we made the sacrifices early on in the course of this that were required to accomplish that. And so we can sort of pat ourselves on the back a little bit for having gone through all that. And it's good to remember that those facts, which I think really are facts, um, especially as we kind of enter this new phase of the pandemic locally and nationally, when it's possible to look at how people are behaving now, and to kind of wonder, you know, what was that all for? I think that's a question that I've had a lot in my mind the last few weeks. We made a lot of sacrifices as communities and as individuals. Some of us more than others, certainly, who had to, had more risk that they had to assume, and it took on more, had more consequences of these types of uh, changes to the way that we behave. Um, and you look at what we're doing right now, and you say, everyone you're seeing people, behaving basically like nothing ever happened. I happened to go to an unnamed city across the river, across the border in Wisconsin, to for something, and I was there very briefly, and this was 2 weeks ago, and it was shocking to me how it was just business as usual, and there was many people milling about, and there was nary a mask in sight, and all the restaurants were bursting at the seams, and it felt as if I was in some strange alternate reality, and there's a lot of cognitive dissonance that goes into that. So, but I think it's helped. The last couple of weeks have really helped to clarify something in my mind, which is just that I think that what I was expecting was that we would do what we were doing to flatten the curve, and then we would look at the data and wait for case numbers to drop to a certain level where we would feel more comfortable interacting with each other in a way that was closer to normal, we would feel that the risk of being out and about was lower. I think it clearly is lower than it was a couple of weeks ago. Um, but I think what's become very clear to me is that we people have just tired of doing these things, justifiably so. And there's so much pressure on our leaders to try to resume business as usual, both literally and figuratively. That what the new situation we're in is that it's not so much that we're going to get to a place where the risk is quite a lot lower, but it's more that we are going to have to, as a culture, as a society, and as communities, find a way to be comfortable with a non-zero level of risk. And that's going to look different for how comfortable people are with that level of risk is going to be different depending on the community, right? So I think that there's a lot of, there's going to be a wide spectrum of behavior that we're going to see people engaging in over the course of the summer. And I think it's up to us as a community to decide where we want to be on that spectrum, if that makes sense. Um, as Joe was saying, it's unreasonable and it's inappropriate to expect that people should have to be that defending themselves. The people who are at the highest risk should have to be, fending for themselves in this environment. But on the other hand, it's also not like we will be able to, if we resume any sort of gathering, offer a zero level of risk. We just won't be able to do that. And I think that there's a bit of a grieving process in my own mind that is sort of an acceptance of that. Um, that I think we all kind of have to get our heads wrapped around one way or another. Um, but that one thing that Joy and I were talking about is that as we start to try to do this in a way that is smart, that really tries to mitigate that non-zero risk, um, we also will not be able to control every single detail, right? Once you open up, it's so easy. It's in some ways the easiest thing to do is to shut down, or to, sorry, not shut down, but to um, to close the church building, right? Um, Once you open it up, then there's sort of a lot more. I mean, I don't need to tell you this, but there are many things that we will just not be able to control, and that could be as simple as just kids wanting to play together. It's going to be hard to stop children from just being kids, right? And we will have to decide whether we're kind of okay allowing some of that to happen, um, which I think, in my mind, I think that there's something reasonable about that, especially if there's kind of a community compact. There's kind of a general sense that um, we're still doing what we can as community members outside of our gatherings together to ensure that we are, doing what we can to prevent ourselves from being spreaders. And as long as we feel that we can rely on each other and we have a shared sense of responsibility to each other, then that might be one of the best ways that we can all feel comfortable, relatively comfortable, interacting together as a community, right? We can sort of do our best both while we're gathering as well as when we're not gathering to reduce that risk. Um, and there are a lot of questions that go along with that, and I don't have the answers to all of them. But as a infectious disease physician, and as someone who's spent pretty much all the last 3 months doing something COVID related, um, I think we're in a different place now, and it is okay to be talking about how we can gather safely. And I think it's what we should be talking about now, because um, it's not fair, it's not right, perhaps in my mind, that we prioritize going to restaurants over going to church. And I think that if we can figure out a way that people can feel comfortable going to restaurants, then I think we can figure out a way that we can figure out for people to at least gather in a church environment. Perhaps it doesn't look exactly like it did before, or at least not for a while, but I think that's what we should be talking about now. And so I'd be happy to continue, providing insight and sort of perspective on those ways of doing that. And I think that's probably where I'll stop right now. Any other questions, comments?
Hey, Tyler, I'm actually going to suggest that people type their questions into the chat box because there may be more questions than we have time for. And then I will pull questions that I think we might have time for from that chat. And then beg of you that you answer the other via email. That work?
I would love to.
Fantastic. Thank you. Like you could say no.
Do I feel that's actually safe to go?
Let's give it a minute.
Do you want me to pause on this for a second?
Yeah, pause. Give everyone a chance to type into the chat if they have a question.
Is this the time when I sing the Jeopardy theme song?
Yeah, basically.
Okay.
Yeah, we already did that earlier tonight with me doing the share stuff at the beginning, so yeah. Liz does have a question just immediately.
Yep, I see that. Do you feel it's actually safe to go to restaurants? Which restaurant? I suppose it depends very much in the same way. I'll just flip it back, but do you think it's actually safe to go to church? I mean, it depends. It depends. It depends. It depends on what the church looks like. It depends on what the actual what the gathering actually looks like, right? So, I don't know the answer to the question. I think it will be safer to be outside than inside. That's obvious. I think it will be safer if the people that are the staff of the restaurant are wearing masks. It's of course not possible to eat while you're wearing a mask, although I think that would be safer. If you were wearing a mask while you were not eating in the restaurant, that would be safer too. But am I going to be going to restaurants? No, probably not for a while. I think we've been trying to support our local businesses with takeout, and that's what I have right now. But that's a question that unfortunately I think everyone has to kind of answer for themselves. It also depends on the person, right? So if you're in a high risk group, then all those answers that I just said are totally different. So I'm sorry that the answer is just it depends.
So the next couple of questions are one's very pragmatic, but they're related.
Mm-hmm.
So
okay. This
one
is
of them specific suggestions for church gatherings, and a more specific and pointed. Can you describe what would make you personally feel safe going to church?
Yeah, I mean, I think it would be wonderful to try. I think something that Joy and I had talked about. It would be wonderful to try to make use of outdoor spaces while the weather permits. I understand that will not always be possible, but it'd be nice to try to do some of that. I mean, every little bit helps. I think it would be possible to use a space like the sanctuary that is large and has windows, especially when the weather permits. If you use it in a way where people can maintain their distances, the 6-foot distancing, I still think that is very powerful. And if most of the people can be wearing masks, I think that would really reduce the risk as well. I think keeping the one thing that would really help would be to keep the sort of gathering very specific. So instead of a usual type Sunday where people are wandering all over the church and interacting in little ways and bumping into each other and passing each other, more of just at least at first, more of just a dedicated like a service, right, would be something that to me would seem like a lower risk enterprise. You could also conceivably have something that you're seeing in stores, which is like a single flow of people.
Mm-hmm.
That could be helpful. I'm sure that there are ways to do that, to direct people to enter through certain doors and exit through certain doors, so that people don't have to be walking past each other and through narrow passages and things like that, at least to the extent that that's possible. I mean, none of these things is going to be perfect. As I said, it's not possible to put things to zero. But I think that there are a number of steps you could take that would actively reduce the risk of gathering inside as well. So does that
So I'm
answer that
gonna,
question a little bit?
yes, and a lot of these are very specific pragmatics. And so I'm gonna have you respond to those via email. And Tyler, I think you're gonna win a spot on a church committee.
I love it. It's been long enough, hasn't
Congrats.
it?
Um,
Yeah, and
so
Tyler, I'll email you those questions so you don't have to worry about the sidebar for tonight. I'll take care of that.
These are all great questions, though. I appreciate it.
and I will ask the one about singing, because that
Yeah,
is
gosh.
a huge question.
Oof,
Specifically for our community, but for many communities. So
I know.
verbal on that would be great.
I so want to answer that question, and I should have anticipated it. I think the jury is a little bit out on like the consensus of singing. There have just been some very high profile. So there's this. The big problem is that there really is asymptomatic transmission. There are people who are, who don't feel sick, who can shed virus, and there are also very clearly now, I think, cases of what we call super spreader events, where there are people who spread the infection to a lot of people, like disproportionately, and that's actually where a lot of this. I mean, that may account for a large fraction of the number of cases in general. And there have also been very clearly documented cases of spreading associated with choirs, specifically, which makes sense given how this virus spreads. Um, you know, is it possible to sing with a mask on? It's not easy, I'm sure. Just imagining what it's like to walk around with a mask on, taking deep breaths is challenging. If it were possible to do so, I would say that would substantially reduce the risk of singing.
I've
So,
tried, not gonna lie, with just a cloth mask,
yep,
and just the amount of spit at the end of it is just
uncomfortable. Yes,
doesn't
uncomfortable.
work. And so unless you're wearing like medical grade, you would be spewing so much stuff. It's so bad.
I know it's really unfortunate because I know it's such a big part of why we all gather. Um, I wonder if there are certain. I'd be surprised if there wasn't thinking about this. If there weren't, I should specifically look at this question and see if I can learn anything. I think we all should specifically look at this question and see what sort of strategies people have employed that seem reasonable for our community, and we can try to phone a friend, perhaps.
Thank you, Tyler. I know the choir has been wrangling with every possible bizarre scenario that would allow for singing. And so short of plexiglass booths, one for each of them, I think we're gonna have to
Yeah, for now, I think until
tread
there's,
gently.
yeah, exactly. Yep.
So, Tyler, one
Yep.
of the things we're going to be doing tonight as part of our business is forming a core of folk who are interested in being part of the conversation. Once we do get the go-ahead, I'll remind people that the Episcopal Church in Minnesota actually dictates when we may regather. We can do otherwise, but that's not without risk for us as a community. So we'd have to have a really strong reason to flaunt that authority. So once that is allowed, though, we need to have a plan in place so we can implement, I think, pretty quickly. So do I have members of the vestry? If I could have, I don't want a ton of people, but if I could have 3 or 4 who would be willing to take the lead on what would need to happen to regather in our space or outside of our space. Because remember, even if we're outside, people might need to use the bathroom, for example. So are there 3 or 4 people, if you could just type your name into the chat. And I know that Dr. Bold will be so bold as to assist.
Of course, I'd be happy to.
Thank you. So Alyssa and Liz, if I could have 1 or 2 more. Dan?
Me.
Is that Michael Nessett?
It's Michael, yes.
Yeah, Dan and Michael. So Alyssa, Liz, Dan, and Michael. So part of your task will be figuring out some of the answers to the questions that Tyler got. And the other tasks are going to be figuring out how to rally the volunteers who are going to need to do some of these things. Putting things like tape arrows on the sanctuary floor, take people. Things like sanitizing between services takes people. So there's a lot of protocol that we'll have to think about. And there are some good documents out there that we can use. But if we could just have a muted round of applause for Tyler. Tyler has been a huge gift to our community, and as is his whole family. I'm so glad that you're part of us, and rock on doing your ministry in the world. I mean, I don't want your job. And I'm so glad that it is your calling, because somebody needs to do that work. And thank you for bridging that space between, thank you for being a scientist who fully understands, and not because you're a scientist, but like a physician in this situation who fully understands why people might long so much to gather in church community. I love that you get it. So thank you, thank you, thank you. I'm going to stop recording. So there we go.